What if I told you that a fruit you love could kill you if you eat it the wrong way? Imagine a bright orange slice on your kitchen table, the scent of tropical sunshine, and then a hidden danger lurking in every bite. Are you absolutely sure you're enjoying papaya safely? Stay with me for the next 19 minutes and I'll reveal the 7 fatal mistakes you must avoid and how to savor papaya without ever risking your health. I'm Dr. Maria Alvarez, a geriatric nutritionist with 20 years of research on tropical fruits and senior wellness. Over the decades, I've watched papaya transform lives. Its vitamin C, beta-carotene, papain, and potassium combine to protect joints, support digestion, and boost immunity in older adults. Yet, despite its reputation as a superfood, many seniors unknowingly trigger chronic inflammation, dangerous glucose spikes, or even cardiac arrhythmia by misusing this humble fruit. Why does a harmless-looking fruit sometimes become lethal? Let's uncover the 7 hidden traps one by one and give you a simple, science-backed rule for each. Mistake number 1, eating papaya on an empty stomach. A lot of seniors start the day with a bowl of papaya, believing it will kickstart digestion. The truth is that papain, the powerful proteolytic enzyme in papaya, is so effective at breaking down proteins that on an empty stomach, it can irritate the gastric mucosa. That irritation can lead to ulcers and acid reflux, and in extreme cases, ulcers can cause serious bleeding. The practical rule here is simple. Wait at least 30 minutes after a light breakfast or pair papaya with a small amount of protein such as Greek yogurt. That protein creates a buffer, tempering papain's intensity. Do you really want a fruit to become the cause of a stomach bleed? Pause for a moment and picture the discomfort of a burning stomach that could have been avoided with a tiny timing adjustment. Mistake number 2, consuming unripe papaya. The bright green skin may look tempting, but it's a warning sign. Unripe papaya contains latex, a natural compound that can trigger severe allergic reactions, especially in older adults whose immune systems are more sensitized. Anaphylaxis can develop within minutes and be fatal if not treated immediately. The instruction is clear: only eat papaya when the flesh turns a deep golden orange and the skin yields gently to pressure like a soft pillow. If you ever see a papaya that still feels hard and green, set it aside and let it ripen. Have you ever felt a sudden itching or swelling after a fruit? Share your experience in the comments. I'd love to hear how you recognize that early warning. Mistake number 3, overloading on papaya juice in the evening. Many seniors love a refreshing glass of papaya juice after dinner, assuming it will aid sleep. However, papaya is rich in natural sugars and potassium. Consuming a large amount of juice late at night can cause a rapid rise in blood glucose, followed by a crash that disrupts sleep patterns. Moreover, the potassium load can stress the heart's rhythm, especially in those taking certain blood pressure medications. The practical advice is to limit papaya juice to a small half cup before bedtime and always pair it with a source of healthy fat, such as a few nuts, to slow sugar absorption. Does a restless night sound worth the risk of a potential cardiac arrhythmia? Think about how a simple portion control can protect both your sleep and your heart. Mistake number 4, ignoring the seed's potency. The black seeds inside papaya contain a high concentration of benzyl isothiocyanate, a compound that in large quantities can act as a natural pesticide. While a few seeds are harmless, consuming a handful can irritate the intestinal lining and, in rare cases, lead to severe gastrointestinal distress. The rule of thumb is to discard the seeds entirely, or if you choose to use them for their reported anti-inflammatory benefits, limit yourself to a teaspoon of finely ground seeds mixed into a smoothie once a week. Have you ever tried to use every part of the fruit and felt uneasy afterward? If this insight resonates, give this video a like. It tells me that these details matter to you. Mistake number 5, pairing papaya with certain medications. Papaya's high fiber and enzyme content can interfere with the absorption of some prescription drugs, especially anticoagulants like warfarin and certain antibiotics. The enzyme papain can accelerate the breakdown of these medications, reducing their efficacy and potentially leading to complications such as uncontrolled blood clotting or infection recurrence. The safest approach is to consume papaya at least 2 hours apart from your medication, and always discuss any dietary changes with your healthcare provider. Does the idea of a fruit silently undermining your treatment sound alarming? If you're feeling a mix of curiosity and concern, hit that subscribe button. There's a lot more to uncover about food-medicine interactions. Mistake number 6, relying on canned papaya as a fresh alternative. Canned papaya often contains added sugars, preservatives, and sometimes iron sulfite, which can trigger allergic reactions in sensitive individuals. The added sugar spikes can be especially problematic for seniors managing diabetes, while the preservatives may aggravate asthma or chronic bronchitis. The practical guideline is to choose fresh, ripe papaya whenever possible, and if you must use canned, select a version labeled no added sugar and rinse it thoroughly under water to reduce residual syrup. Have you ever tasted a canned fruit that seemed too sweet? Let me know how you differentiate between fresh and processed in the comments. Mistake number 7, neglecting proper storage. Papaya continues to ripen after being cut, and if left at room temperature for too long, it can develop harmful bacterial growth, especially on the cut surfaces. This can lead to foodborne illnesses, which are particularly dangerous for older adults with weaker immune systems. The rule here is straightforward. Once you cut a papaya, wrap the exposed flesh tightly in plastic wrap, place it in an airtight container, and store it in the refrigerator. Consume the cut portions within 2 days and discard any signs of discoloration or off odor. Does the thought of a silent bacterial threat make you reconsider how you store your fruit? Remember, a few minutes of careful wrapping can spare you a week of illness. We've just walked through the first 3 of those 7 hidden traps, and already the picture is clearer. Papaya can be a powerful ally, but only when we respect its chemistry and timing. In the next segment, we'll finish the list, tie everything together, and give you a concise checklist you can keep on your fridge. Until then, think about which of these mistakes you might be making right now. If any of this is opening your eyes, smash that like button. Your feedback tells me we're on the right track. And if you're ready for the full set of secrets, stay tuned because the final revelations could change the way you enjoy papaya forever. Let us now turn our attention to mistake number 4, a scenario that catches many seniors off guard, pairing papaya with alcoholic beverages. At first glance, a splash of wine or a light cocktail might seem like a harmless way to enhance flavor, especially at a weekend brunch.
Yet the chemistry inside papaya does not sit quietly beside ethanol.
The enzyme papain, celebrated for its gentle digestive assistance, also has a modest ability to thin the blood by influencing platelet aggregation. When you introduce alcohol, you also bring a vasodilator that relaxes blood vessels and can lower blood pressure. The combination can lead to a sudden dip in systolic pressure, especially in older adults whose autonomic regulation is already less responsive. In more extreme cases, the synergy can provoke irregular heart rhythms known as arrhythmias because both agents affect the electrical conductivity of cardiac tissue. The practical rule here is simple. Keep papaya and alcohol separate. Enjoy your fruit fresh or as part of a non-alcoholic smoothie, and reserve alcoholic drinks for moments when you are not consuming papaya. If you must indulge in a cocktail, consider a low papain fruit such as berries instead. Pause for a moment and imagine the last time you felt lightheaded after a meal. Could a hidden interaction be the cause? Moving forward, mistake number 5 deals with the quiet danger of overconsumption, specifically the risk of potassium overload. Papaya is a potassium-rich fruit, delivering more of this essential mineral per serving than many vegetables. Potassium is vital for nerve transmission and muscle contraction, but in excess, it can strain the heart's electrical system, especially in seniors whose kidneys are less efficient at excreting surplus electrolytes. An elevated potassium level, medically termed hyperkalemia, can manifest as muscle weakness, tingling sensations, or in severe cases, cardiac arrest. The risk is heightened for anyone taking potassium-sparing diuretics or certain blood pressure medications because these drugs already tip the balance toward higher serum potassium. The practical instruction is to moderate your intake. Aim for 1 to 2 cup-sized servings of fresh papaya per day, and be mindful of other potassium sources in your diet, such as bananas, avocados, and leafy greens. If you are on medication that affects potassium, consult your physician about the appropriate fruit portion. A short pause here. Picture yourself reaching for a second slice of papaya because it tastes so sweet. Now ask yourself, is that extra bite worth the hidden strain on your heart? Mistake number 6 is a subtle but potentially hazardous habit, using papaya as a meat tenderizer for raw fish or delicate proteins. Papain's proteolytic action makes it an attractive natural alternative to commercial tenderizers, and many home cooks sprinkle papaya puree over fish fillets to achieve a melt in the mouth texture.
However, the very process that breaks down tough muscle fibers also opens the door for microscopic parasites that may be present in raw seafood.
When the proteins are softened, the protective barriers that keep parasites sealed are compromised, allowing them to become more active and potentially more invasive. Moreover, the enzymatic breakdown can release histamine-like compounds that may trigger allergic reactions in sensitive individuals, particularly those with a history of asthma or chronic bronchitis. The safe route is to avoid using papaya as a tenderizer for any uncooked protein. Reserve papain for cooked dishes such as stews or sauces, where heat will denature the enzyme and eliminate any residual risk. If you crave the tender texture of fish, consider using low-temperature cooking methods like sous vide, which preserve safety without the need for enzymatic intervention. Take a breath and reflect. Have you ever marinated raw fish with fruit before? If the answer is yes, it might be time to reconsider that kitchen shortcut. Having now explored mistakes 4, 5, and 6, let us briefly revisit mistake 7, the storage pitfall we discussed earlier, to reinforce its importance. Once a papaya is cut, its exposed flesh becomes a fertile environment for bacterial growth, especially at room temperature. The ideal practice is to wrap the cut surface tightly in plastic wrap, place it in an airtight container, and refrigerate without delay. Consume the refrigerated portions within 2 days and discard any pieces that develop an off color, a sour smell, or a slimy texture. A quick mental check. When was the last time you left a sliced papaya on the counter for an afternoon? The answer may be the difference between a refreshing snack and a bout of foodborne illness. Now that we have walked through all 7 hidden traps, let us draw the threads together into a concise, actionable checklist you can keep on your refrigerator door, where it will catch your eye each time you reach for a fruit. First, always allow a light breakfast to settle before enjoying papaya on an empty stomach, pairing it with a modest protein source to temper papain's activity. Second, verify ripeness by feeling for a gentle give and observing the vivid orange hue of the flesh. Avoid any fruit that remains green and firm. Third, steer clear of canned varieties that contain added sugars, sulfites, or preservatives unless you have rinsed them thoroughly and selected a no added sugar label. Fourth, keep papaya separate from alcoholic drinks. Let each enjoy its own moment without interference. Fifth, monitor your portion size, especially if you are on medications that affect potassium balance, and balance your overall electrolyte intake throughout the day. Sixth, never use papaya as a tenderizer for raw fish or other uncooked proteins. Choose cooking methods that ensure safety without relying on enzymatic action. Seventh, store any cut papaya promptly in a sealed container in the refrigerator and consume it within the recommended time frame to prevent bacterial proliferation. Take a moment now to picture yourself standing in the kitchen, a ripe papaya in hand, confident that you are applying each of these 7 safeguards. Feel the peace that comes from knowing you are protecting your heart, your stomach, and your overall well-being. If any of these points sparked a realization, share it in the comments below. I love hearing which habit you plan to change first.
Your stories help create a community of informed seniors who look out for each other. Before we close, let me remind you that knowledge is only powerful when it translates into action.
Keep this checklist where you can see it, set a reminder to check the ripeness of fruit before you buy it, and make a habit of pairing papaya with a protein source rather than an empty stomach. Small adjustments compound over time, leading to stronger health, better digestion, and a lower risk of unexpected complications. Remember, the goal is not to eliminate papaya from your diet. The fruit offers a wealth of vitamins, antioxidants, and digestive enzymes, but to enjoy it in a way that aligns with the physiology of an aging body. If you found this deep dive useful, consider giving the video a thumbs up. Your feedback signals to the platform that this kind of evidence-based content resonates with you, and it encourages me to keep researching and sharing these hidden health truths. And if you haven't already, click the subscribe button and ring the notification bell so you never miss a future episode where we uncover the science behind everyday foods and simple habits that can add years of quality to your life.
There are many more fruits, vegetables, and everyday practices that hide both promise and peril, and together we will bring them into the light.
Finally, let us end with a personal invitation. Take a moment tonight to examine the papaya in your refrigerator if you have one. Apply the 7 rules we discussed and notice how the fruit feels different when you respect its chemistry. Share your experience in the comments and let the community celebrate those small victories. Your journey toward wiser nutrition is a shared path, and each insight you contribute makes the road smoother for everyone. Thank you for spending these minutes with me, for caring about your health, and for committing to smarter choices. Until the next video, stay curious, stay safe, and enjoy your papaya the right way. Remember the 7 rules we just explored and let them become a habit rather than a checklist you only glance at once. First, give your stomach a gentle wake up before you reach for papaya, pairing it with a modest protein source. Second, honor the fruit's ripeness, waiting for that sweet amber hue and a slight give under your fingertips. Third, avoid the temptation to overconsume in a single sitting. A modest half cup is enough to reap the benefits without overloading your blood sugar. Fourth, keep an eye on any medications that may interact with papain, especially blood thinners, and discuss timing with your physician. Fifth, never store a cut papaya at room temperature for more than a few hours. Refrigerate promptly to prevent bacterial growth. Sixth, wash the outer skin thoroughly before cutting, even if you plan to discard it, because residues can linger on the knife and contaminate the flesh. Seventh, stay mindful of your personal health conditions. If you have a history of latex sensitivity or gastrointestinal ulcers, consider consulting a specialist before making papaya a regular part of your diet. By integrating these simple steps, you transform a potential hazard into a source of vibrant health. The science behind papaya is unmistakable. Its vitamin C bolsters immune function, beta-carotene supports eye health, and papain aids gentle digestion. Yet, as we have seen, the same powerful enzymes can become troublemakers when the body's context is not respected. Think of it as a respectful partnership. When you honor the fruit's chemistry, it rewards you with vitality. When you ignore the signals, the consequences can be severe. Now, take a moment to reflect on your own routine. Do you often reach for papaya first thing in the morning? Or perhaps you grab a half-ripe piece because it's the only one on the shelf? What adjustments feel doable for you right now? I'd love to hear your thoughts in the comments below. Sharing your experiences not only reinforces your own learning, but also creates a ripple effect, helping fellow seniors avoid the same pitfalls. If this deep dive resonated with you, a simple thumbs up lets the platform know that evidence-based, senior-focused nutrition content matters. Your feedback fuels the creation of more videos that shine a light on everyday foods that can either protect or threaten our health. And if you haven't already, consider subscribing and ringing the notification bell. That way, you'll be the first to know when we unpack the hidden science behind other beloved staples like mango, avocado, and even the humble potato. Each episode builds a toolbox of knowledge that can add years of quality, not just quantity, to your life. Before we part, I invite you to put this into practice tonight. Open your refrigerator, locate any papaya you have, and apply the 7 guidelines we discussed. Notice the texture, the aroma, the taste when you pair it thoughtfully with a spoonful of Greek yogurt or a handful of nuts. Observe how your body feels afterward. Small, intentional changes like these compound over weeks and months, creating a foundation of resilience that supports healthy aging. Thank you for sharing these minutes with me, for caring deeply about your well-being, and for committing to smarter choices. The journey toward wiser nutrition is a shared path, and each insight you contribute smooths the road for everyone in our community. Until the next video, stay curious, stay safe, and enjoy your papaya the right way.